retina, leading to tractional retinal detachment. Okay, so that is about the pathogenesis. Okay, so it is ultimately the microvascular leakage and the microvascular occlusion due to cellular damage and also various hematological and biochemical changes. Okay. Then coming to the classification of diabetic retinopathy, so it is according to early treatment diabetic retinopathy study. Okay, ETDRS is early treatment diabetic retinopathy study. So the diabetic retinopathy is classified into non-proliferative diabetic retinopathy, proliferative diabetic retinopathy, diabetic maculopathy, and advanced diabetic eye disease. Okay. So again, non-proliferative diabetic retinopathy may be mild, moderate, severe, or very severe NPDR. Okay, and so what are the lesions that we see in non-proliferative diabetic retinopathy? Okay, so the first one being the microaneurysms. Okay, so they are the earliest detectable lesions in diabetic retinopathy. Okay, so they are nothing but the focal dilatation of the capillary walls due to loss of pericytes. Okay, so are you able to see here that there are multiple small reddish dot-like lesions? Okay, so here there are multiple reddish dot-like lesions. Okay, so these are all microaneurysms. Okay, whereas the bigger ones are dot and blot hemorrhages. These are dot and blot hemorrhages, but the microaneurysms are very small dot-like reddish lesions. Okay. So on fundus fluorescein angiography, okay, so this is the fundus fluorescein angiography picture. So we inject sodium fluorescein dye into the antecubital vein, and then we take the fundus photographs. Okay, so we see multiple hyperfluorescent white lesions. Okay, dot like white lesions. Okay, so they are all microaneurysms. Okay. So it's very difficult to differentiate between microaneurysms and the dot and blot hemorrhages clinically. Okay, so on FFA we can easily identify. Okay, whereas the retinal hemorrhages, they produce hypofluorescence. Okay, they produce blocked fluorescence. Okay, retinal hemorrhages. Whereas microaneurysms, they produces hyperfluorescence. Okay, hyperfluorescent dot lesions. Okay, they are the microaneurysms. Then coming to retinal hemorrhages. In diabetic retinopathy, we see dot and blot hemorrhages, which are deep hemorrhages. Okay, so I told you that the deep hemorrhages are present in the deeper layers of the retina, which are compactly arranged. Okay, so that is why they are very small and well defined. Okay, so these are all the dot and blot hemorrhages. Okay. And then we may find superficial hemorrhages in some cases. Okay, so and then hard exudates. See, in hypertensive retinopathy, we get superficial hemorrhages, and the cotton wool spots are soft exudates. Okay, they are the feature of hypertensive retinopathy. Whereas in diabetic retinopathy, we get deep hemorrhages, which are dot and blot hemorrhages, and also the hard exudates. Okay, these hard exudates are also present in the deep layers of the retina. Okay, so that is why they are well defined. Okay, and they are small in size. Okay, so these are all the hard exudates. Okay, the hard exudates are yellowish white, waxy looking patches. Okay, so they are nothing but macrophages filled with lipoproteins and lipids. Okay, so they may be present in clumps or sursinates. Okay, so sursinates means in circles. Okay, so because the hard exudates are nothing but leaks from the microaneurysms, so they're surrounding the microaneurysm. Okay, so at the center of these sursinates, we can see the microaneurysms, which are responsible for leakage. Okay, so the hard exudates are present in clumps or sursinates. Sursinates means in circles. Okay, like this. So these are the hard exudate sursinates. Okay, and then we can find the edema. Okay, so edema is seen as retinal thickening due to capillary leakage. Okay, so we can also get the cotton wool spots and the superficial hemorrhages in diabetic retinopathy. But the characteristic features of diabetic retinopathy are like deep hemorrhages and the heartache states and the microaneurysms. Okay, and we do find other lesions like venous changes, which are nothing but looping. Okay, so this is the looping and then beading. Okay, beading of the veins and then segmentation of the veins. Okay, so these are the venous changes. Okay, then we get intraretinal microvascular abnormalities. Okay, intraretinal microvascular abnormalities. So they are known as the edemas. Okay, so these edemas are nothing but the AV shunt vessels. Okay, then they don't leak the dye and fundus fluorescein angiography. Okay, so this is the FFA picture. We are able to see these edemas. Okay, coil-like vessels. Okay, so this is the artery and this is the vein. So these are the AV shunt vessels. Okay, so here are you able to see? Here's the shunt vessels. Here also we can see the shunt vessels. So they don't leak the dye. Okay, they look like new vessels, but the new vessels they leak the dye on fundus fluorescein angiography, whereas the edemas they don't leak the dye on FFA. Then coming to, so those are all the changes that occur in non-proliferative diabetic retinopathy, like so the microaneurysms and then the dot and blot retinal hemorrhages and then the cardiac states and the retinal edema and then the venous changes and then edemas. So these are the lesions that we see in non-proliferative diabetic retinopathy. Okay. Then coming to mild NPDR, I told you that non-proliferative diabetic retinopathy is again divided into mild, moderate, severe, and very severe NPDR. Okay. So in mild NPDR, we see few microaneurysms and retinal hemorrhages. So like here, we are able to see few microaneurysms and then the few retinal hemorrhages. Okay, heartache states may or may not be present. Okay, then coming to moderate NPDR, we see the microaneurysms and the intraretinal hemorrhages in 2 or 3 quadrants. Okay, heartache states and cotton wool spots may or may not be present. There may be early mild edemas. Okay, so here we are able to see multiple dot and blot hemorrhages and then the heartache states here. Okay, so here also dot and blot hemorrhages and the heartache states. Okay, so microaneurysms are intraretinal hemorrhages in 2 or 3 quadrants. Heartache states may or may not be present. That is moderate NPDR. Okay, then coming to severe and very severe NPDR. So we have 4:2:1 rule. Okay, so that means 4 quadrants of microaneurysms are hemorrhages and then 2 quadrants of venous bleeding and 1 quadrant of edemas. Okay, so if any one of the above features are present, it is severe NPDR. Okay, so any 2 or more of the above features are present, then it is very severe NPDR. Okay, so we are able to see here the multiple dot and blot hemorrhages and also the heartache states, multiple heartache states. Okay, so this is severe NPDR. Okay. Then coming to proliferative diabetic retinopathy. So proliferative diabetic retinopathy is characterized by the presence of new vessels. Okay, so there may be either neovascularization over the disc or neovascularization elsewhere in the retina. Okay, so in more than 50% of the diabetics after 25 years, so we see proliferative diabetic retinopathy changes. Okay, so NVD or NVE, neovascularization over the disc and neovascularization elsewhere in the retina. Okay, so these new vessels they grow along the major temporal retinal vessels. Okay, these are the temporal vessels. So they grow along these major temporal retinal vessels. So these vessels, new vessels, they may be present in the plane of the retina or they may extend into the vitreous cavity. Okay. Then, so I told that along with these new vessels, there will be proliferation of fibroblasts, okay, leading to the formation of fibrovascular polyps. Okay, so this fibrous tissue it contracts. Okay, so when it contracts, it produces traction over the new vessels, and I told that these new vessels are very fragile and they bleed easily, leading to the formation of vitreous hemorrhage or preretinal hemorrhage. Okay, and also these fibrovascular polyps, when they contract, they can also produce traction over the retina. Okay, traction over the retina, leading to the retinal detachment. Okay, the retina is separated from the retinal pigment epithelium. Okay, that is known as retinal detachment. Okay, so that is known as, because it is produced by the traction, it is known as tractional retinal detachment. Okay, sometimes what happens is, when because of this traction by this fibrous tissue, there will be formation of retinal holes. Okay, so retinal holes leading to the retinal detachment, which is known as rigmatogenous retinal detachment. Okay, so the retinal detachment due to retinal hole is known as rigmatogenous retinal detachment. So in diabetic retinopathy, there may be tractional retinal detachment or a combination of fractional as well as the rigmatogenous retinal detachment. Okay, so these are the fibrovascular polyps which are extending along the temporal major retinal vascular arcades. Okay, so there are two types of proliferative diabetic retinopathy. Okay, PDA without high risk characters and PDA with high risk characters. Okay. So, what are the high risk characters? So, they are neovascularization over the disc, 1/4 to 1/3 of the disc area, with or without vitreous hemorrhage or preretinal hemorrhage. Okay, so that means we measure the neovascularization. Um, uh, 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 we compare it with the size of the disc. Okay, so one disc area is, I told you know that it is 1.5 millimeters. Okay, so 1/4, so 1/4 to 1/3 of the disc area of NVD with or without vitreous hemorrhage or preretinal hemorrhage, and or NVD less than 1/4 disc area with vitreous hemorrhage or preretinal hemorrhage. Okay, and then NVE more than half disc area with vitreous hemorrhage or preretinal hemorrhage. Okay, so these three are the high risk characters. If any of these characters are present, then it is PDR with high risk characters. So this is the fibrovascular proliferation, okay, with vitreous hemorrhage. Okay, so this is the PDR with high risk characters. Okay, because the fibrovascular proliferation is more than one disc area. Okay, with vitreous hemorrhage. Okay. And then coming to the diabetic maculopathy. Okay, so the diabetic maculopathy may be diabetic macular edema, otherwise known as clinically significant macular edema, or diabetic macular ischemia, or diabetic macular traction. Okay, so this is the classification of diabetic maculopathy. Okay, so there are different classifications. Okay, so basically, diabetic maculopathy is these three varieties. Okay, diabetic macular edema, which is known as clinically significant macular edema, then diabetic macular ischemia, and then diabetic macular traction. Okay, then coming to diabetic macular edema. Okay, so this is due to increased permeability of the retinal capillaries. Okay, so if one of these three criteria are present, then it is known as clinically significant macular edema. Okay. So retinal thickening within 500 microns of the foveal center, and then hard exudates with retinal thickening within 500 microns of the foveal center. Okay, and then edema of one disc diameter. Okay, so one disc diameter means it is 1.5 millimeters. Okay, so edema of one disc diameter, any part of which is within one disc diameter of the foveal center. Okay, so these three are the criteria for clinically significant macular edema. Okay, retinal thickening within 500 microns of foveal center, and then hard exudates with retinal thickening within 500 microns of foveal center, and then edema of one disc diameter. Okay, any part of which is within one disc diameter of the foveal center. Okay, so I told you know that these are the hard exudates with retinal thickening. Okay, so the retinal thickening we cannot see with this two-dimensional picture. We can see only with the three-dimensional picture that we get with the plus 78D examination or with indirect ophthalmoscopy. Okay, so these are the microaneurysms. Okay, multiple microaneurysms which are leaking into the macular area. Okay. Then coming to the clinico-angiographic classification, okay, of diabetic maculopathy. Okay, so that means on doing fundus fluorescein angiography, we classify the diabetic macular edema, diabetic maculopathy. Okay, so it may be focal maculopathy or diffuse maculopathy, ischemic maculopathy, or mixed maculopathy. Okay, so we will see. Okay, so the focal maculopathy is leak from the microaneurysms. Okay, so here on fundus fluorescein angiography, we are able to see the microaneurysms. Okay, so these are the hyperfluorescent spots. Okay, these are the microaneurysms which are leaking the dye. Okay, so leak from microaneurysms produces focal maculopathy. Okay, we are able to see the multiple hard exudates. Okay, with retinal thickening. Okay, and then diffuse maculopathy. Okay, so this is diffuse retinal edema